All right, everyone. We are back with part 3 of your week 5 lecture. In this lecture, we're focusing on the urinary system. And so, just like you saw with digestive, we're looking at terms, abbreviations, anatomy, common procedure, guidelines, and ultimately you being able to select the codes. So, the urinary system's main purpose is to um, remove waste from the body. There are, of course, in the beginning of your chapter, a list of abbreviations. Someone asked me recently, should they write all these abbreviations in their manual? And what I would just remind you is that um, your book is going to be reviewed when you take your exam. So let me just be clear about something. AHEMA has a candidate handbook, and this candidate handbook is must reading for you as the examinee. You don't know how many times I get messages from people, generally on YouTube, like, can I write in my book? That's a great question. AHEMA has addressed that in the candidate guide. And I think it's important for everybody to know, if you're the test taker, the expectation is that you've read the candidate guide, because honestly, I um I don't really go onto the AHEMA website unless I'm paying my dues. I'm looking for a particular article, but I'm not taking a test, so I'm not going onto the website to look for exam information. So very, very important for you to just look at all things AHEMA exam. Um, I am actually going to be doing something regarding the AHEMA exams. So look out for that. All right, so here are the abbreviations. I lost track because I was thinking about the number of times I see, not just on YouTube, I was thinking about Facebook too, where people are asking questions like, how many questions are on the exam? What do I bring to the exam? And I know it's natural for people to ask someone who they figure knows the information. But I took the CCS exam in 2006, and a lot of things have changed since I took it. And you don't want to go off of the word on somebody from social media. You need to you need to research it for yourself. All right, so those were the abbreviations. The main structures of the urinary system. So the urinary system includes kidneys, which are on both sides, ureters, which are on both sides, the urinary bladder, and then the urethra. So the kidneys are located in the back of the abdominal region of the body, on either side of the vertebral column. Their function is to um, remove waste products from the blood and regulate the volume and composition of the blood by allowing reabsorption of water and other substances into the bloodstream. On average, a kidney weighs about 5.5 ounces and is 10 centimeters long by 5.5 centimeters wide and 3 centimeters thick. All right, then you have the ureters. Be careful. Ureters, urethra. So the ureters are the tubes that are coming from the kidneys, these muscular tubes, and they're lined with mucous membrane. They move the urine from the kidneys into the urinary bladder. The urinary bladder is located in the pelvic cavity. It is a temporary reservoir for urine. Fun fact, an average size bladder can hold about 1 quart of urine. Did I mention there are 2 ureters? Did I mention that? That is important because there is only one urethra. And the urethra is a mucous membrane lined tube that transports urine from the bladder to be excreted from the body. Fun fact, most adults know this. The length of the urethra is different for males and females. For females, it's approximately 3 to 5 centimeters long, whereas male, the urethra is approximately 18 to 20 centimeters long. Um, the external sphincter is below the neck of the bladder. It controls the release of urine from the body. Ooh, and as you get older, it just is a whole vibe. All right, moving right along. So we're gonna go to our first body part, which are the kidneys. There are 8 subsections in this particular area. You have incision, excision, transplants again, introduction, repair, laparoscopy, endoscopy, and then other repairs. And we're going to first start with procedures that are incisions. And we start off with um, repair, I'm sorry, not repair, drainage of abscess, either a perirenal or a renal abscess. You also have a differentiation of percutaneous drainage versus open drainage. You have incision into the kidney. You have incision into the kidney to remove a stone, nephrolithotomy. All right, as it relates to excisions, you have removal of a kidney, removal of a ureter. You also have excision of cyst in this particular area. Renal transplantation, I don't even got to say. All I got to say is the word 3 components. You know the deal. All right. Moving on to introduction. In this particular area, you are seeing codes for introduction of catheters into the renal area and other introduction services, introduction, injection, change, or removal for the renal pelvis. There are some codes that are out of numerical order, so you want to pay close attention. If you're like, I can't find something, it could be, above or below. All right, next up, we have repairs on the kidneys. And in the index, you want to make sure you get the right code. So, pyeloplasty, this is plastic surgery that's on the renal pelvis of the kidney. Nephrorrhaphy, this is suturing a kidney wound or injury. You also have symphysiotomy, and this is symphysiotomy for a horseshoe kidney. It's a correction of an abnormal union of the kidneys. All right, and then of course we got some laparoscopy and endoscopy. And just like other sections, diagnostic is included in the surgical. These codes are organized for the surgical endoscopy based on the reason for the procedure. All right, on to the next body part, the ureter. Ureter. There's 2 of them, right? So we have procedures for incision, excision, and introduction. And then we also have repair codes, laparoscopy, and endoscopic procedures. So as it relates to the and I'm moving along fast. As it relates to the bladder, we also have excision and introduction procedures. In fact, you got incision, removal, excision, introduction, urodynamics, repair, laparoscopy. I mean, it's a long list. All right. So as it relates to um, excision and introduction, you have codes to report excisions completed on the bladder. So words that you want to pay attention to: cystotomy, incision into the bladder; cystectomy, removal of the bladder. Um, you have incision of or introduction of um, catheters, changing tubes, just to name a few. I need to drink more caffeine before these lectures. Let me get some more hot tea. Oh, urodynamics. So urodynamics is the study of holding and storage of the urine in the bladder, the motion and the rate of the movement of urine, and analysis of how the bladder empties. There's a bunch of notes in front of these codes. Many of the procedures are performed at the same time. If that does occur, you want to use a modifier 51. Um, these services also reflect that they were done by the physician, and so that the physician supplies everything for this test. And if that is not the case and the physician is only interpreting the test, modifier 26, for example, may be necessary. All right. So then we have repair. So notice the slide says 2 of 2. That's because the author of the book included diagram, and I removed all the diagrams because it would have made the slides too long. All right, so for repair, you have cystoplasty, cystourethroplasty, urethropexy. Pexy is fixation. Cystoraphy, suture, closure, and then you have enterocystoplasty. All right. We also have laparoscopic and endoscopic codes. These codes are differentiated by whether the procedure was performed for a urethral suspension, for like stress incontinence, or a sling operation for stress incontinence. That's the inability to hold the urine. These procedures include things like irrigation and evacuation of clots, ureter catheterization, biopsy, as well as ejaculatory duct catheterization. All right, transurethral surgery. And you've seen the word trans, right? That's through or across. So these particular codes are reporting transurethral surgery that is completed by the use of a cystourethral scope. The code range is divided into 2 subsections: procedures that are on the urethra and bladder, procedures that are on the ureter and the pelvis. You got to read the instructional notes. These codes are also differentiated by the gender of the patient, um, and it's lots of notes over here. That's all I can say. It's lots of notes. You want to pay close attention to them. Vesicle, neck, and prostate. Here, you're going to see codes such as cystourethroplasty for resection or incision of the ejaculatory ducts. You're going to see transurethral procedures on the prostate. You are also going to see laser coagulation, laser vaporization, laser enucleation of the prostate. And you also are going to see drainage of a prosthetic abscess. So the slides definitely don't tell you everything that's included, which is why you should be bubbling and highlighting your books. All right, now we're on to the urethra. Here you have incision, excision, repair, and manipulation procedures. You see the list of procedures here. And notice you're seeing the same words over and over and over again. So, the one area to specifically call out are the dilation of the urethra, so the manipulation, right? These codes are differentiated by male versus procedures completed on females, if this is an initial procedure versus a subsequent, and then the type of dilation. And you're going to see that reflected in the code. So you want to look for it in the documentation. And we just completed all things urinary system. Next up, we're going to the male genital system.